I just celebrated my 52nd year in nursing in March of 2025. I actually started out at age 14 as a candy striper at what was then called Bismarck Hospital here in Bismarck. From then, when I was in high school, I worked after school as a nurse's aide, and then I went to nursing school and came back to Bismarck Hospital again to work as a nurse. And then just in the last 20 years, I became involved in public health, mainly for disaster responses, things like pandemic influenza, and of course, most recently COVID. I'm very fortunate in that our family is very close. In fact, so close that one of my daughters lives 3 doors away from me. And so I have the privilege of seeing my grandchildren every day.
My mom always instilled in us to have a servant's heart. So my sister and I have been volunteering for the community since we could walk, before we could talk.
I always taught them, if you can give to your community and be a responsible individual in your community will give back to you. I'm a third-generation North Dakota gal. I'm very proud of that. I am a product of Bismarck. I was born and raised here. And I have been also so blessed in life to have such good friends. I have girlfriends that I've had for 62 years. I have girlfriends that I've had for 40 years, and I have girlfriends that are fairly new girlfriends. And girlfriends come from all walks of life. It doesn't matter how long we've been friends. To me, a friend is a person who you can pick up the phone, you can call them or you can text them, and you know that they will be there for anything that you might need. And I certainly experienced that with the cancer diagnosis. I have to say I was a little surprised because I've always considered myself as healthy. I had none of the normal markers. I never used tobacco products. I didn't drink alcohol. I ate clean, healthy food. I exercised regularly. I just never thought in a million years that someone would say to me, "You have cancer." I remember saying to my doctor, "Well, are you sure?" She said, "Pathology is showing that you have DCIS, which is ductal carcinoma in situ." And I knew what that was. I thought, okay, well, you know, that's probably not too bad. And I always felt, okay, we caught it early. We know how to treat it. We have such a good healthcare system.
I'm a radiologist at Sanford Health. I'm the lead physician for breast imaging, and I'm chief of staff of the medical center. I work with breast cancer every day, so from the standpoint of a patient's daughter, I tried to just be as supportive as I could and try not to just be the doctor and say, "You're fine, you'll get over it, it's not a big deal." It is a big deal, especially when you're the patient.
The next week or two was a bit of a blur. I think I had maybe 10 to 12 doctor's appointments in that time frame.
I was more concerned about how she was going to deal with it, given that she takes care of my grandma and she takes care of my kids during the day. And I was just hopeful that she would take care of herself mentally and physically and have the support around her so that she'd be able to get back to the things that she enjoys doing.
From day one, I had phone calls, I had text messages, I had girlfriends preparing meals. They were always calling, stopping by, just to make sure that I had everything that I needed. And at first it was hard for me to accept that, but it started feeling really good. And I thought, okay, I can do this. My girlfriends are here and I'm gonna be okay. No matter what happens, I'm gonna be okay. If I could go back to day one and tell myself anything after I've been through the treatment and the remission, I would just tell myself, just keep the faith, stay the course, know that you have a healthcare team that are experienced and extremely caring. I don't think there's any better place to go than Sanford Health.
Being the daughter of a breast cancer survivor now, I have the unique perspective of being on both sides, the doctor and as a family member or a patient. I've been there. My mother had breast cancer. She got through it.
And I think because of what I've gone through, I'm in a better position now to be able to encourage my women friends and my girlfriends that don't get their screenings to get them. I think it's important to be an advocate to share the story with them that not only am I a nurse and know what this is and have treated women with this, but I myself have gone through it, and I can tell you this is not fun. Get your mammograms.